Hi, my name is Ali Mittermeier. I'm the CEO and one of the co-founders of CIT Clinics. And with this video, I want to give you some quick upfront instructions for how to submit a referral for ketamine for trauma and PTSD care. So I'll do that right up front. And then for those of you that are actually interested in learning more about how ketamine works and why CIT Clinics, the second two-thirds of the deck, I'll walk you through that. So first and foremost, CIT Clinics, we are Northern California's premier provider of what we call comprehensive health services for patients suffering from trauma and PTSD related issues such as anxiety, depression, OCD, and even chronic physical pain. And what's exciting about this partnership is that we now can offer you a really fast, reliable, highly professional track to getting your clients the help that they need using compounds like ketamine and combining that with psychotherapy and really offering them the best care that exists in Northern California for anyone that's struggling with trauma or PTSD related issues. So I'm going to jump right into how that works and how you can do that. We made it really simple for you. You need to just remember this one URL, citclinics.com/GCF. If you have a client that you would like to refer our way, you can use that. On that link, there's a form. You fill out the form where you give us your contact information, you give us their contact information, and then we take it from there. So we will, obviously contact them, verify whether or not that this is an appropriate clinical intervention to support them. And then if it is, we will take them through the onboarding steps and do all the things that we do as a medical clinic that's really experienced in providing these services. And if for whatever reason it's not, obviously we will communicate with you. In fact, we'll communicate with you throughout the entire process. So we'll let you know that we've made contact, and we'll just keep you abreast of all of the headway that we're making with that client. I also want to give you direct access to myself. If you have questions, if you want to set up a one-on-one meeting at a time that's convenient for you, then please use this URL, citclinics.com/Ali. You can also scan in this QR code on your phone and just set up a meeting with me. I can obviously answer any administrative questions, financial questions, logistics, all of the above, and I'm happy to do so. I just want to make sure that you, as we're leaning into this this new program, that you always feel supported and have access to myself or someone who can answer those questions for you. So that's the nuts and bolts of how to do this. This next part of the presentation, I'm actually going to walk you through some of the background. If you're interested in understanding more about ketamine and CIT Clinics and how this whole thing works, this might be really interesting for you. If not, then this is technically all you need to get started, and I look forward to supporting you. Okay, without further ado, so why ketamine? Why psychedelics? And in short, the answer is that we are currently living through an epidemic of trauma and untreated PTSD in this country. The statistics are pretty shocking. This is based on a study of 2,000 adults, and they were basically asked a series of questions around these mental health issues related to their PTSD and trauma. And it's quite astounding. You have, double digits of, in a 12-month period, 41% of respondents said they were struggling with anxiety, with overwhelm, had a depressive episode, loneliness and isolation. What's not in here is, the rates of suicidality are up. It's a pretty stressful time for a lot of people. And so presumably that includes your clientele. And what exacerbates this issue is that not much has changed in the way Western psychiatric medicine is addressing depression and anxiety. They treat it very much as these pathologies rather than as symptoms of underlying PTSD. And so enter, folks like us at CIT Clinics who have been doing this for many years now, working with these, using these compounds like ketamine and down the road, probably psilocybin and MDMA as well, just in a very novel manner to support patients that are struggling. And so, you have this along with this explosion of, on the demand side, you also have, popular media is writing more and more about how ketamine is impacting mental health in this country. And most relevant to us or to you is the amount of research that is validating that these approaches that we've been taking now for many years now, that they actually work. And so, the way we see that up, here's a chart that I wanted to show you. This is the number of, since 1975 and 2020, the number of research publications that combine the word ketamine and mental health. This is how dramatically this has grown. So we are right in the middle of the crest of this wave of ketamine and psychedelics being used as a primary tool in mental health care treatment. And I'd like to think that, again, we've been around for many years now here in Northern California, and it doesn't get any better than, I think, the protocols and the approaches that we take. So about CIT clinics, we get a lot of patients coming in from Kaiser or the VA, and when they first walk into our clinics, their jaws frankly kind of drop. They look at it and say, wow, this does not look like a medical clinic. And then we assure them that we are a licensed medical clinic, this is all above board and legal and so forth. But the point being is that so much of psychiatric medicine, again, at the Kaiser and places like the VA, are treating ketamine from a very procedural standpoint, right? So patients talk about these experiences where they go into a room that has 4 or 5 other patients in it, and they're all under fluorescent lights and hospital gurneys, and they're all getting ketamine. And it just, at best, represents just a real fundamental misunderstanding of how to set up an environment that is conducive to people healing with these medicines. And at worst, it's just being, some of these providers just being cheap and not wanting to put the energy and the effort that we put into really creating a comprehensive or holistic environment. And of course, it starts with the way the clinic looks. So you can see here, it's very much set up for psychedelic experiences. There's always a clinical team consisting of anesthesia, nursing, and then psychedelic guides. Then if need be, psychotherapists, and all of these sessions are followed up outside of the clinic with what we call integration coaching. So again, this is a really comprehensive model where we make sure that the environment that patients are in while they're having these experiences is conducive to this being a positive experience. And then afterwards, certainly making sure that they're staying on track and are engaging in a way that is helpful and stimulates long-term benefit. So this is our original founder, our fearless leader, Adam Tibble, Dr. Adam Tibble, taken in Afghanistan many years ago, where he was a medical transport doc, flying helicopters and bringing wounded soldiers in from the field, and then oftentimes transporting them on to Germany. And now keep in mind, these are really wounded, banged up human beings, some really gnarly wounds. And so a whole cocktail of medicines was administered, including ketamine. And what Dr. Tibble noticed about ketamine is there was something special about not just the way it took pain away, right, so the analgesic properties of the ketamine, but also how it altered the patient's perception, just from an existential standpoint or a consciousness standpoint, of what this wound meant to them and how they were going to fare, and gave them a sense of hope and a greater sense of groundedness and equanimity, rather than a panicky, really distressed feeling. So he came back stateside after his tours and opened up a ketamine clinic and followed many of these initial protocols that were started at Yale University of administering ketamine in a prescribed manner. And then eventually I'm down on the right, obviously in the middle is Dr. Danforth and Dr. Tibble on the left. We joined forces and we made the decision to say, let's do this right. Let's really provide comprehensive care. So let's take the best of Western evidence-based clinical medicine and combine it with many of the traditions that come from indigenous cultures in South America who have been using these psychedelic compounds in a medical and a healing context, let's merge the two, let's do it safely, and let's really step it up a notch. And so that's what we do. We'd like to think we go beyond just doing ketamine, right? There's lots of ways you can get access to ketamine, anything from a street drug all the way through to, ordering lozenges online. But it doesn't really address the long-term healing, issues that patients have. So we focus on this multimodal approach that constitutes or results in sustained healing. And so that includes intravenous ketamine and nutrient therapy. That's high doses of vitamin C and vitamin B complexes and magnesium and sometimes even NAD and glutathione. And the idea is we already have an IV in the patient, so let's give them the best of the best that we can in addition to the ketamine and support them physically as well as psychologically. And obviously, really skilled psychotherapy support for patients going through the process. All of these sessions are guided, so we don't just put someone in the room, stick them with ketamine, and then leave. We actually pay attention. We're in there with them, and we're supporting them, and we're really managing their dose. We're managing their psychological experience throughout this journey. And then also really important is what happens in between the sessions, right? So the healing doesn't just happen when you're on ketamine in the clinic. The healing also happens 2 days later when you're on an integration call with one of our integration coaches or specialists and posing the questions like, what does this all mean? How is this, contributing to your sustained well-being? And the proof is in the pudding. So the blue line here that you see is these old protocols that were developed, 20, 25 years ago of 6 ketamine sessions. And that's, you're really doing just these procedures, and then you leave the patient alone. What happened there is you had about a 63%, uptick in feeling, self-reported feeling better, followed by a drop off again within, a few months, and oftentimes several months down the road, followed by yet more traumatic experiences and patients coming in saying, oh, I need more ketamine. So we took a step back and we looked at that and said, well, why don't we take advantage of the initial uptick that we get from these initial ketamine sessions, but if we then combine that with comprehensive care, so the integration coaching, the behavior change classes, we have a daily session that patients can practice sessions that they can participate in called 15 minutes of positivity. So Monday through Fridays at noon, a lot of patients sign on, and we teach them how to practice emotion regulation and how to practice, gratitude and all of these pro-social or positive behaviors that constitute long-term well-being. That's really the end goal of doing these treatments. We have an incredible reputation out there across the board. We get 5-star reviews, and it's not uncommon, that we see reviews come in where people will say things like, this clinic saved my life, or the staff at the clinics was amazing and went above and beyond. And it's also not uncommon that we get reviews like this. I can't think of any other businesses really that get these. And, sometimes patients will write little essays on their experience. It's not uncommon that it's 2, 3, 4 paragraphs worth of anecdotal description of what they went through. So again, there's something special that we're doing, and it's reflected in how patients respond to us. And so let me summarize this, what I would call the CIT clinic's difference. And hopefully this will help equip you with some background information on, if you're speaking with your clients and they have questions about, why CIT clinics or why work with us, you'll have a better sense of what's going on there. So first and foremost, the approach. As I mentioned, we are not procedurally focused. Yes, we perform procedures in the clinic, but our ethos or our philosophy goes beyond just doing procedures or doing ketamine. We really view this as a holistic healing journey, and our entire team is oriented around that approach. We do this incredibly safely. So just the fact that we do intravenous administration is, probably the most safe way of doing it. Remember, anything that you ingest, so if you ingest a lozenge or get an intramuscular injection or even squirt ketamine up someone's nostrils, there's no reversing that. whatever that dose is, whatever experience they're having, they're kind of stuck with that and they're going to need to ride it out. We avoid that whole complication by doing it intravenously, which means we can increase the dose. We can literally stop or pause the experience that they're having within minutes. And then we can start it up again. So we really keep the patient safe. Efficacy, this comprehensive care model, as I showed you earlier, that chart really shows that there's a much, much more efficacious long-term outcome than if we just focused on giving patients ketamine. Our team is about as experienced as it gets. So one thing I'd like to highlight is that part of, again, our ethos or our culture is that every one of our staff, be it a integration coach, an MD, an anesthesiologist, a nurse, whoever it is, part of their training is that they go through the process of being a patient at our clinic. So everyone has firsthand experience with ketamine, knows what it's like to be sitting in the recliner and having this experience in the environment that we've set up. And that just, makes all the difference when a patient walks in the door and says, I have no prior experience with ketamine or psychedelics. I'm nervous. I don't know what to expect. We can quite honestly, let them know that, we got you covered, and we will, we know what this experience is like. Lastly, longevity. Again, our goal is to just iterate and learn every step of the way. So we've come a long way over the last 6 years that we've been doing this, since Dr. Tibble came back from Afghanistan and started his clinic. We have really, I think, perfected this idea of a comprehensive approach, and it shows. Patients really do a lot better. Okay, back to how we will support you. Our goal is to make this as simple as possible for you. So I'm going to come back full circle to all you need to know is this URL. From there, you can submit your own information, some information about the client, and then let us handle the rest. And we will keep you in the loop every step of the way, make sure that you know what's happening with a patient. And again, if you have questions, I'm happy to make myself available to speak with you. You can set up a meeting here just by going to citclinics.com/Ollie or scanning in this QR code. Happy to speak with you as many times as it takes for you to really understand the benefits of ketamine and certainly our approach and how we do it. And really appreciate you putting your trust in us, and really look forward to supporting your clients. I think we can, together make a really profound difference in the way mental health is practiced in Northern California, and blaze a new trail here. So really looking forward to meeting you and working with you, and take good care. Speak with you soon.